Hello, thank you. It's an honor to be part of this panel today, a privilege. You might or might not know that in each of the federal regions for the United States, of which there are 10, there is at least one pediatric environmental health specialty unit. They're called PESUs. And the PESU for this region, Region 2, is located here at Mount Sinai. We are charged with helping make up for the paucity of environmental health education that pediatricians and physicians in general receive during their medical training. So we function primarily as a non-emergent call center, kind of like the poison control centers that you heard about just now, but without the 24/7 coverage. Callers include health professionals, government agencies, the media, and also the public on topics ranging from lead to mold, BPA and dental sealants, mercury, but we also provide outreach and education around important issues that the public might not yet perceive as a health risk. And it's in this latter role that we've gotten involved in educating about hydrofracking. So we were consulted by the state branch of the American Academy of Pediatrics in regards to the New York State moratorium on hydrofracking last year. And that activity helped to coalesce our thoughts and subsequent involvement. So I'm going to give you some specific thoughts on hydrofracking health risk today, but first I'll couch my comments in a larger context. Much of the debate has centered around hydrofracking, yes or no. But as we heard last night, echoed by Josh Fox after the screening of Gasland, the bigger question is really fossil fuel use, yes or no. And some argue that renewables are still in their infancy, but they're currently making up an approximately proportionate share of the market as fracked gas. So in many ways, we as a nation, and certainly as a regional community, are at this decision fork about which way we go. And there are certainly many health risks to children from a continued reliance on fossil fuels as a primary source of energy. And I'd be happy to speak about those risks as well. Those certainly have massive global effects. But to stay a bit focused right now in these opening comments, I'll summarize 3 major areas of investigation from our perspective as pediatric environmental health specialists that we think are needed before any further hydraulic fracturing should take place. So we think that further study and planning is needed in 3 areas. Number 1, water issues. Number 2, a comprehensive health impact assessment. And number 3, in disaster management planning. So just briefly on each of those 3, very briefly. The first, water supply and contamination, already has some momentum because there's a currently planned EPA investigation. The already existing issues have been covered well in terms of drinking water contamination in the series last month in the New York Times. We need to consider both the carcinogenicity, and also the potential endocrine disrupting effects, both from the water, the chemicals in the fracking fluid, and also in those that are liberated from underground by the fracking process itself. So at a minimum, further hydrofracking needs to await the results of this EPA study, and we need to have time for proper consideration of the findings before proceeding. On the second point of emphasis is that the water study is not sufficient to understand the overall health impacts of hydrofracking. Health impact assessments, or HIAs, are a tool designed to consider a larger picture in terms of both time scale and spatial scale. And these would include not only the health impacts from changes in water that might occur from hydrofracking, but also the other effects of the hydrofracking industry, such as additional noise, air quality changes. These are exposures that are known to increase cardiovascular and respiratory health risks like heart attacks and asthma. So lastly, we ask for a disaster management plan that specifically includes provisions for child safety, both physical and psychological. So in all 3 of these areas of investigation, the vulnerability of children, their greater pound-for-pound water and food consumption, their longer number of years of life ahead of them, and their still developing bodies and minds need special consideration. So the goal of this additional work that we're requesting is really to make the true costs of hydrofracking transparent, and it's only really then that we feel we can make proper comparisons between the energy choices that we face. And then lastly, I just want to say, for those in the audience who are looking for tips on best ways to advocate, I'd encourage you to seek additional voices of support from professionals of a diverse fields. Much like a number of the advocates already in this audience, have done by partnering with documentary filmmakers, environmental protection experts, geologists, and health experts. I'll also extend an invitation to students at any level of training, from college to postgraduate, to consider a rotation with us here at the PSU. Thank you.
Okay, thank you. Hi, I'm Tracy Carluccio with Delaware Riverkeeper Network. I'd like to take a minute to begin out looking at the how-to of activism and why activism is really how we're going to get our hands around this issue of natural gas development. First of all, we're learning a lot, and these various studies that we've just been talking about and earlier today, as we find out about the toxins, about the health impacts, about the environmental impacts that are associated with natural gas development, we're learning a lot. And as an activist, my goal, and those of us in this room working on this, our goal is to do something with that knowledge, with what we learn, to try to change the trajectory that we seem to be on. And it's much like activism in other fields, as was talked about earlier today by our two speakers. You could be preventing causes of disease, you could be curing disease, you could be researching the mysteries that we don't understand about human health. You could be working for protection of public health, or simply humbly caring for the sick. There's a lot of ways that activism, you can carry out through activism your chosen path. And with environmental activism, it's the same. And on an issue like this, natural gas development, the use of fossil fuels for our energy, that is very big, and there seems to be a lot of moving parts, just like there is with medicine. And sometimes it seems like a giant puzzle. We've got to find all the pieces and put them together, like a Rubik's Cube or something. And other times it seems like just maybe an elegant fitting together of two things that fit, the wedding of those things. But in order to accomplish any change in that trajectory, we need to take a look at what our goals are. And I'd like to use a couple of one example in particular of identifying goals, then identifying targets, figuring out the how-to get there, and then using the tools we have at hand, understanding the limitations we have at hand in order to get to our goal. Now, an example of that is something that my organization and a lot of groups represented here at this conference have been doing, which is to work for the protection of our environment. And in the Delaware River watershed, we were formed in 1988, Delaware Riverkeeper Network, and we had a wild and scenic river. And so, in the goal of looking at what we had, we realized that we needed to protect that wild and scenic river. So we started working through the agency that oversees the management of the Delaware River Basin to put additional regulation in place that would require not only protection of resources or protection of existing uses, such as 15 million people who get their water supply from the Delaware, but an anti-degradation policy that would not allow the exceptional water quality and resources that were recognized by the federal designation, and also not allow that water quality to be diminished in any way, and allow it to continue to improve. Because of course we had just come through a devastation attached with the industrialization of our early nation, and really the Delaware and none of our rivers have totally healed from that. So it's an anti-degradation goal, and it's a goal of continuing to allow the natural systems to heal. So as we move forward through that, natural gas came along after we managed to get this agency, Special Protection Waters designation, in place for the entire non-tidal river. It took, at first, 2 years, in 1992, the upper and middle, and then it took several years to get the lower Delaware designated wild and scenic, and then 2008, finally, the entire non-tidal river designated Special Protection Waters, that anti-degradation program I mentioned. It's grounded in a provision of the Clean Water Act. When natural gas came along, we realized, okay, this is going to undermine everything that everybody has done to bring this river back and to continue to improve it. And So we had to go looking around at our tools and our targets. We had to look and say, well, we have to get the Delaware River Basin Commission, who has the ultimate authority, trumping all state regulations, to take a look at this and say, hey, we recognize that this extraction process and the development of this fuel has the potential for negatively impacting the water resources of the basin, which is the measure that they use in special protection waters. And we managed to do that. And that happened in May of 2009, and then we worked for a moratorium because there had been no gas development yet, and we wanted to make sure that did not happen while studies were being done. We were fighting for a cumulative impact analysis, and while regulations were being developed because the DRBC had no regulations to govern this type of activity. A moratorium was put in place. And then after that, we then worked to make sure that nothing slipped between the cracks, and there's litigation associated with that. But we continued to work to try to get this cumulative impact study funded and to get through other coalitions at the national level and the interstate level working for federal protections to undo the exemptions from the 7 major environmental laws that the natural gas and oil industries are exempted from. And while that process is going on and the moratorium's in place, the Delaware River Basin Commission, unfortunately, prematurely issued draft natural gas regulations, which we're in the process of commenting on right now. And I know many folks have been signing the letters that are outside there because we need to get the public comment on the record before April 15th that these regulations are not going to meet this anti-degradation and improvement standard. And we have hired experts to analyze them, and they're in the process of technically explaining on the record why these regulations are not going to protect from pollution and avoid degradation and continue to allow the river to heal. So that's an example of looking around, identifying your goal, which our goal is to prevent pollution, avoid degradation, and continue to allow the natural resources, the natural processes, natural features to heal, and then using the tools you have at hand in order to try to keep or prevent the untoward circumstances that would come from any activity that would undermine that, and then working and being open to engage the public as much as possible, the institutions as much as possible, and to work at all levels, national, regional, state, and local, in order to energize the public and have an iterative process that continues to allow that knowledge we talked about in the beginning to be filtered through and used in this process of reaching our goal. So we're not there yet, but this is an example, sort of a dissection of one thing that we've done in our watershed to try to address this natural gas activity. And at the end, we'll take questions and answers. I think that the bottom line here, and the thing that we find most challenging, is there is the short-sightedness that we all seem, as human beings, to possess. It's a political animal, the Delaware River Basin Commission. It's made up of the governors of 4 states and a federal representative from the Army Corps. So politics has a lot to do with decisions that are made. We have to make sure that science, we have to make sure that the big goals of anti-degradation and improvement out-trump those political considerations. And that's everyone's goal, I think, here in all of the states, the 39 gas-producing states where we're facing this. And I think the bottom line is, are we going to sacrifice our water for gas? We say we cannot sacrifice our water for gas. We can't trade one resource for another. And as we move through the coming weeks and months, we'll find out whether or not we prevail. Thank you.
Good morning. So my name is Vince Padre, and I'm a physician in private practice, and my specialty is integrated medicine and prevention. So I've been involved with holistic healthcare, and I sort of call myself an accidental environmentalist because I never thought that I would be involved with a cause like this, but I was always fascinated with environmental issues, and when I finished my training at Mount Sinai, I spent a year at the World Trade Center screening program. So I had a consciousness for these issues, and through my training and understanding in holistic health, I realized that we can't ignore the effects of environmental toxins even at very low levels on our health. And this is a growing problem in our society. So 2 years ago, my wife and I bought a property in what is part of the Delaware River Basin, about 5 miles from the river and actually about 10 minutes from where Josh Fox's house is, next to the Delaware River. And we had no idea that this hydrofracking process was coming to the region, and started learning about this. And as I researched and learned more about the potential health effects and the types of chemicals, and I spoke to scientists like Theo Colburn that has the endocrinedisruption.com website that they research these chemicals, and I started becoming concerned that this was a huge public health threat. And then I started finding out that this was not just in my region, it's the entire Marcellus Shale, which spans Ohio, Pennsylvania, West Virginia, into New York State and the Catskills, and right underneath our precious reservoirs in our watershed. And if you look at our reservoirs, it's one of 5 municipal water supplies that has a federal exemption from having to have a filtration system, because the water comes down so clean. I mean, it's actually a marvel of engineering that water comes down with gravity and does not have to be filtered. I mean, obviously they have to add chlorine to it, but you want to preserve this precious water supply. And it's not just New York State, and it's not just Pennsylvania. They're actually doing this in 34 states across the country. They're starting to do this in the United Kingdom. They're looking into it in Germany. Argentina has discovered a shale in Patagonia. India has been sending their oil companies here to study what we're doing with hydrofracking to do it over there. So this is going to become a worldwide problem. And we really need to think about water as a precious resource and what can happen to it. So I wanted to talk about some of the, as a private practitioner, I started learning about the organizations that are involved with this and decided that I needed to do something about it. And when you choose a cause, you have to feel passionate about it. It has to come from your heart. And you also have to believe that you have a voice. That is really important, because you think maybe my voice is just one droplet in a sea of voices. How can it make a difference? Well, it can. It can when the voices are united and all of us speak together in unison to protect public health. And as healthcare practitioners, I feel that we have an obligation to do so. And you have to believe that writing a letter to your senator, or calling the senator's office or your congressman, or writing a letter to the Delaware River Basin Commission is important. One of the comments in one of the last DRBC meetings is that they're not hearing enough from doctors and healthcare practitioners, and they really should. Same thing from the legislatures in Albany. They say they don't hear enough doctors raising concerns about these issues. I mean, we really should be speaking about this. So one of the ways that I found has been very powerful in connecting and having a voice is social media. And we see the power of social media and Facebook and Twitter in Egypt, and it's really becoming a force. It's a way to educate people and spread the word much faster than we could have spread it any time before. And it's a way to provide a different message than what maybe the oil companies are preaching to us, or even the EPA at times. We might not be getting all the information that we should from them, as we saw in the New York Times articles recently. So I say connect with a cause that you feel passionate about. Look at their websites. Look at their presence on Facebook, on Twitter. Start following them, because they're always posting interesting information. Spread the information among your friends. This is how the information is disseminated, and we can get more and more people to understand what a big issue this is, and the people have to speak to protect our water. The other idea I had on lessons I've learned is even call one of these organizations and ask them if they need a volunteer for something. I mean, you may be very busy, your life may be very hectic, but perhaps you have 2 hours on a Saturday that you could help them out, and they need something. They might need help with their paperwork, or maybe they're doing a table somewhere in the city. So there's always ways to help even when you think you don't have the time, and it doesn't take much time to look at the websites and look at the action alerts that you can do, and just go on the web and send an email to a congressperson telling them, I feel passionate about this particular issue, and I think you should do this. They need to hear from us. And then lastly, what I wanted to say is to educate yourselves about the issue. And a really good website to learn more about hydrofracking is ProPublica, and they have a whole section on gas drilling. And also, if you go to any of the websites, the Delaware River Keeper Network, the United for Action, NYH2O, there is a plethora of articles in there that you can read, scientific articles about what the potential health impacts are. And you know, if you feel passionate about it, join the cause. Thank you.
Good afternoon. I'm Al Appleton, and the instructions I've been given about what to speak about would take approximately 50 minutes. So if this seems a little hurried, please bear with me. When I think of public health, and all the people who've done so many marvelous things, I'm reminded of the advice I was given at age 20 when I went to work for the post office, and there was this grizzled old veteran of Omaha Beach who was teaching me how to drive all the complicated trucks. And he took a liking to me, and so one day he gave me his best life advice, which is advice he said he got from a sergeant who'd served in World War I when he trained him. And he said, kid, in war, you get killed for two reasons. You get killed because of the law of averages, or you get killed because you did something stupid. Now, there's nothing you can do about the law of averages, or apparently this microphone. Okay, this sounds good. So concentrate on not being stupid. Public health is our society's attempt not to be stupid. And lots of times we don't succeed. But one of the critical components of American public health for well over 100 years has been water. Indeed, as a former director of the New York City water and sewer system, I often think that there's a problem with water both here and worldwide, that we have forgotten its roots in public health. New York City built the New York City water system not just because it needed water, because it was tired of having cholera epidemics. It was after the last great cholera epidemic in the city that we finally sucked it up and built the water system. So gas fracking is a huge threat to water systems. It is two other threats, though, that I think are really critical to understand, though because of this audience I'm going to concentrate on the first. Gas fracking tears up the environment. And the local rural environments, for example, the 250,000 acres of trees we would lose in the Delaware River Basin with uncontrolled gas fracking, are critical to the integrity of water supply and water quality. And the other thing, of course, is that gas fracking is a stab in the back of green energy. And gas fracking, fossil fuels, essentially looking to the past, while green energy is what we are looking to for the future. And I could do a whole separate talk on that, but not here. Now, the problem with gas fracking as a health thing is quite simple. First of all, it uses several hundred toxic chemicals that can get into the environment in numerous ways. And secondly, the gas fracking process down in the shale liberates a kind of fluid that the gas industry has a technical term for, but it has got brine, radioactivity, and lots of other interesting and nasty chemicals that it can bring back to the surface. These are chemicals that are often have toxicities expressed in the parts per billion. So that it does not take a lot of these chemicals to get into water and begin to turn it around. And some of these chemicals can volatilize, but many others, when they get into the sediments, remain suspended in the water column, and they can do fairly nasty things. But it's not the nasty things they could do like that that's the ultimate worry. As many people have commented for all the generations I've been following this issue, it's the cumulative effect over time of low levels of toxins in body tissues. that are the thing we as a society must worry about, and gas fracking is only the latest threat to these kinds of problems. So in the 5 minutes that are left to me, what to do? The first thing is we have yet to definitively ban gas fracking in the New York City watershed. You know, this issue has somewhat got to sleep, but if you look at the law and you look at the statements carefully, gas fracking has not been unilaterally, unequivocally, and for all time banned in the New York City watershed. It's sitting there, a nice, open, juicy target. And the first thing is we should demand that that watershed is forever off limits with respect to gas fracking. Now, the second thing is, as Tracy was, and the others were alluding to, we do not have a manageable system of regulation. But for the areas in which we are prepared to allow gas fracking, and I would submit that at least half the landscape should be off limits because of their water, economic, or environmental sensitivity, we need comprehensive regulations that are enforced. Now, we don't even have comprehensive regulations, but if we could get them, we don't have the enforcement capability to do them. When we did the New York City watershed program in the early 1990s, we added 400 people. Lab people, monitoring people, planning people, enforcement people, remediation people. This for an area 1/8 of the size of the fracking territory in New York and Pennsylvania, and for what is a less complicated technical problem. The only way that enforcement capability will be delivered is if the gas industry pays for it as a cost of doing business. And any regulatory system that does not include fees appropriate to provide the several hundred enforcement personnel that are the minimum necessary to do this job right is essentially just a waste of paper. So that if and when you do intervene in this issue, you must talk not only about the regulations, not only about the ban, you must talk about providing the enforcement. And that has to be a bill that has to be on the back of the industry. And needless to say, the industry is not reacting any too kindly to that issue. Now, the industry likes to say that, you know, we're for the environment and we support, you know, reasonable regulation. There's two truth tests here. And after a year or two of trying to get the industry to the table and finding out that they really didn't mean it, I have ceased to be interested in bringing the industry to the table unless and until they agree, one, that critical areas like the New York City watershed, like the Delaware River Basin, should be off limits to all fracking, and two, that there should be an adequate enforcement capability. Some of you may have seen the piece in the New York Times Monday where the columnist basically said that. The industry is being completely myopic in its opposition to regulation, because it's only with good regulation it's going to get gas fracking. And this is something I and several others told Governor Patterson a year ago, and the message is still there for both the political and the industry system. Now, there's a lot of tactical advice, and it's all good advice that you've heard from other members of this panel. So I'm not going to add any to it. There are two letters, though, that if any of you wanted to write, you could definitely write. The first would be to Governor Cuomo and say, we want the New York City watershed and other significant watersheds in New York, to use his term, sacrosanct, made sacrosanct legally. And by this I mean not only New York City, I mean the Delaware River Basin, I mean the watersheds for Syracuse and Rochester, I mean the groundwater for Elmira and Binghamton, for the municipal wellheads in western New York. All of these people, can I forget Lake Otsego? I do not want to go up to visit the Hall of Fame and seeing fracking rigs on the hills outside Cooperstown. These are perfectly reasonable things. If the industry is right that this is a $1 trillion business, well, they can make it a $500 billion business by leaving all of these sensitive areas over. And last time I checked, no one ever starved making $500 billion. The second letter I would like to see everyone write is to Shelley Silver, the Assembly Chief Majority Speaker, who has been very good on this issue, but he must understand that there can be no compromise in the New York City watershed, no compromise in these other watersheds. Flat out, no, this is a simple choice. You will hear a lot of people say this issue needs to be studied more. There are aspects of this issue to which I agree. I do not agree that it needs any more study to tell me that an industrial process that's going to peel the landscape, risk all of these chemicals, needs to be banned in watersheds. That can be done right now without any further study. And I would not put too much faith in these studies. The EPA's study just dropped the issue of ozone emissions from these plants as part of its study component, even though Wyoming is now regularly out of ozone compliance, not because it's 2 million person cities, but because it's 25,000 gas fracking wells. Trust your own common sense on these issues. I don't like the distinction between activists and citizens. We all are citizens. And some of us have skills and some of us have a taste for being a little more hands-on, but everyone should be involved with this issue. If it's only at a cocktail party to throw out, when someone talks about those natural gas commercials you see in the morning with children dancing among the flowers and hearing about all the jobs that's been created, of course none of the people in those jobs ever get any toxic contamination. Just know that this is not true. Just know that there's a better way to be doing these things. We as a society have been for 200 years, 246 years, from the time of James Watt in 1765, addicted to fossil fuel. And in the first 200 years or so, the cost of fossil fuel was very minor compared to the incredible wealth that created us. If we were meeting 250 years ago, we'd be on wooden chairs with privies and candlelight. That we are not, although we still have to go down 2 stairs to get to the bathroom. Fire the architect next time. Is due to fossil fuel. It's hard to get people off of this. But we've come to a point, and if you go to Cooper Union and look at their land, which will be at Grand Central in April for Earth Week, look at the landscapes of extraction exhibit. You will see that the price we're paying for fossil fuel is higher and higher, and the benefits are gradually shrinking. It's time to move on. The fight against gas fracking is not just a fight for public health. It's not just a fight for rural New York. It's not just a fight for your pocketbook. It's a fight for a future that has weaned itself from the addiction to fossil fuel. From a future that says, if this is a fossil fuel source, it's good. Personally, the gas having been down there for 600 million years since the shell was formed, I'm perfectly happy to leave it there for another 600 million years. And if we have to compromise in a few places, well, let's make the compromise one that looks towards the future, not the past. Last statement. I have a small beef with my own colleagues in the environmental movement. Too many of them are worried about regulations that the DRBC is putting out, and not enough are worried about just banning fracking in the Delaware River Basin, because I think there's no rational basis for it. So if you want to write a third letter, you can write the Delaware River Basin Commission and tell them that there is no reason to support this practice in this incredibly important watershed and viewshed. You should ban it. Bill, thank you.
Thank you.